Keep in mind that there is a tremendous variation in names of procedures, techniques used, and the extent of effect of procedures utilized by thousands of surgeons. The informative description here certainly does not apply to everyone, and you should discuss these details with your surgeon during your consultation.
Although there are many techniques in facial rejuvenation surgery, the goal of a facelift is to improve specific effects of aging and have the result look natural, not surgical. The sagging tissue below the cheekbone should be lifted up to provide youthful fullness in the cheek. The hollowness under the eye should be improved, and there should be improvement in the nasolabial fold. The jowl should be removed and the jawline should become distinct once again. The contours of the neck should be improved as the bands are retightened or released and the excessive skin removed and redraped. Excess fat in the face and neck can be removed under direct vision or with liposuction to further improve the facial contours. Although excess skin will be removed, the skin that is left is still your old skin, and its quality will be unchanged without accessory procedures. The patient is wearing makeup in her after photo on the right, which makes her skin quality look better than it is without accessory procedures.
This is a before and after photo of a patient who has benefited from a Browlift, upper and lower eyelid surgery, facelift, and a chin implant. Specifically, the facelift has allowed her to regain the youthful fullness in her cheeks, as well as the clean contour of her mandible and neck as the jowls were improved. She enjoys the natural result and looking like the same person, just more refreshed.
To accomplish these goals, there are very important additional considerations. You want to have a very natural and enduring result, minimal scars, and no distortion of anatomic landmarks, such as the ears or hairline. This should all be accomplished safely. The effects of facelifting should not extend to the mouth, causing distortion, as this indicates the pull is too hard. The wind tunnel look is certainly not natural or desirable and should be avoided at all costs. Most skin wrinkles and the nasolabial fold cannot be completely removed. Small children have nasolabial folds, and its complete absence is unnatural because the face appears stretched. Excessive tension ultimately gets transmitted to the incisions, causing distorted hairlines, earlobes, and bad scarring. This can lead to anxiety rather than confidence and comfort in public without a crafty hairstyle. Here is an example of a distorted anatomic area such as the ear. On the left, scarring and a poorly designed pull has left no visible doubt to a casual observer that surgery was performed. On the right is a patient who has had a facelift, however, surgical attention to detail and proper design allows the appearance of an ear that was not operated on.
A facelift should be contemplated by a person when there are definite needs that can be improved and the patient is willing to trade off the chance of improvement for the exposure to risks, the recovery period, and the expense for that improvement. I advise against doing facial surgery too early or too often. A patient should carefully measure how much improvement they are really looking for from such an extensive procedure. In my opinion, doing the small mini lifts should be reserved as the last lift in your lifetime. They do not last as long and distort valuable anatomy needed for the more thorough lifts. Because they are less extensive and easier to perform, it makes sense to do these as a touch-up procedure later in life when your health is not as good. It is then that a shorter time in the operating room, relatively safer procedure, and easier recovery period makes sense. Your physician should not cut corners during your initial lift, as these violations of dissection planes and formation of scar tissue can affect the success of your future surgeries.
The proper technique to be utilized for facelifting is based on your surgeon's comfort, judgment, and experience, and your individual unique tissue qualities. In very general terms, there are basically two types of lifts. There is a superficial skin lift and a deeper plane lift. This deeper plane lift has many names depending on how deep the dissection level is and the anatomical extent dissected. Some associated names include the composite lift, SMAS lift, and subperiosteal lift, among others. The advantages, disadvantages, and differences in outcomes from these various techniques are not really clear and controversial among many surgeons. Outstanding results can be achieved with any technique in certain surgeons' hands. You should go over the technique plan very carefully with your doctor because there are many variations. A skin lift involves dissecting and lifting up the skin and redraping it after removing the excess. It is probably the fastest, least technically demanding, and most common type of facelift. It is Dr. Fisher's opinion that this type of lift more frequently leads to poor scarring, unnatural wind tunnel type pulls, and shorter lasting results since so much tension must be placed on the elastic skin. Deeper plane lifts are more technically challenging. They involve a deeper dissection and lifting of the deeper tissues and muscles. This deep tissue is lifted and put under tension and acts as a vehicle to transport the overlying skin to a more youthful location. Therefore, there is less tension on the skin, which theoretically leads to less tension on the scars. Ultimately, the scars and skin have a more favorable opportunity to heal well, as the circulation is not as compromised. Some surgeons will tighten the deep plane with sutures without actually dissecting under it.
Two types of facelifts basically. One is a skin lift, where you're dissecting underneath the skin and then you pull the skin really hard. The problem with that is a lot of tension ends up on the incision or the scar, so the scar heals a lot worse because there's so much tension, and you can have distortion of anatomic features such as hairlines in the ear. The other type of lift is a deep plane lift, where you take the deep plane connected to the muscles underneath and you pull the deep plane real hard and the skin catches a ride on it. So all the tension is below, underneath, not along the skin edges. And that seems to make incisions heal a little bit better.
Some surgeons will advise doing a facelift through an endoscope. This is a small mechanical lighted tube like a periscope shown here, which is used to view and perform the surgery. This generally means that very small incisions will be made and scarring will be kept to a minimum. Usually, the deeper plane is entered and the tissues are suspended by a series of sutures until scar tissue forms and holds the tissues in place. Although this technique may result in smaller scars, many surgeons feel possible disadvantages with endoscopic facelifts are that excess skin cannot be excised, and generally not as much can be done through the small openings as they could with traditional techniques. Competent plastic surgeons have different levels of experience with certain techniques and appropriate reasons for why they choose different procedures. Again, there are many appropriate and useful procedural designs, variations, and techniques to perform a facelift.
I feel that it is more important that the surgeon is experienced and is skilled with the technique he or she chooses than whether the technique is new or not. Sometimes new techniques are later abandoned after extensive scrutiny over time reveals they were not such a good idea to begin with. Because of this, enthusiasm over unproven new technology should be hopeful but tempered.
The incision and ultimate scar location vary and are very important. Generally, with non-endoscopic techniques, incisions can be placed in the temporal area within or in front of the hairline. The advantages of being within the hairline, as in incision number 1, is an easier ability to hide the scar. The disadvantage is that the entire hairline can be pulled back unnaturally. Incisions in front of the hairline, like incision number 2, may yield scars that are easier to see. However, the hairline is generally preserved. The incision and scar placement around the ear is also critical. The normal and natural anatomy of the ear should be preserved, and the scar not visible to prevent an easy tip-off that you have had facelift surgery from across the dinner table. Incisions can be made in front of the ear as shown with line 3, or in a variety of ways inside the ears as shown with line number 4. Scars in front of the ear as shown on the left are often very noticeable even though they preserve the anatomy of the ear. You can readily see the scar as well as the skin color and texture change with this incision choice. These are very difficult to conceal. Incisions inside the ear are ideal if done correctly as shown on the right. Be sure you ask for and see before and after photos of the ears of your surgeon's facelift patients. It is even better if you can actually look at and talk with some patients of that surgeon prior to selecting that surgeon to perform your facelift. Here is a similar example in men who usually have shorter hairstyles. This attention to detail is even more important for them. An incision in front of the ear on the left certainly saves time for the surgeon, but is difficult to conceal for a lifetime for the patient. Incisions and resulting scars from facelifting generally continue behind the ear and into or down along the edge of the hair behind your ear. These incisions are necessary to provide adequate exposure to your neck area for removal of excess neck skin and possible contouring. Again, scars should be minimized and the hairline should be preserved, allowing you to wear a ponytail or feel comfortable with a short haircut. Here is an example of a scar by which you would be handicapped by. Its location and appearance would cause a great deal of anxiety for you and prevent you from wearing certain hairstyles. However, the scars on the bottom would allow you the freedom of any hairstyle. These incision choices are even more important in men who usually have shorter hair. These detail issues should be very important to you.